If you're hearing a lot of crunching, it's because Molly is eating her femur, and as we are working, and she doesn't want to put her femur down. So this is a cow femur for our musculoskeletal, and this is Molly, who is very happily chewing that. So I apologize for the crunching, but you can see that she doesn't really want to give that up. And how could you blame her? You know, who doesn't want to be eating that delicious, sat on the floor for a week bone? So back onto muscular skeletal. Um, you know, the biggest thing is impaired mobility and permanent impaired mobility. So we want to avoid that at all costs. Obviously, for your test and for your practice purposes, you need to know the 5 Ps inside and out. And those are very, very important for your basic assessment and making sure that you're not going to cause further damages to the patient. So for crutches, patients will leave the ER for crutches, and you guys will be responsible for doing that. And they must be fitted properly. Same thing with a cane. Now, it talks in chapter 9 on page 71 about tips for measuring crutches. You'll also need to make sure that the patient understands how to use crutches. Crutches are not to be leaned on. They can actually injure the nerve that runs under the arm, which is brachial nerve, and they can end up with severe brachial plexus problems. So patients need to be careful using them. They should not wear socks without shoes because they could slip. They should not wear high heels. And I'm telling you this because they will do that if you don't tell them otherwise. So you need to measure very carefully when you're sizing them. They and you will actually be putting the crutches together. So you need to make sure that it's properly adjusted for the patient. And you will certainly learn that during your orientation program. And some facilities have small, medium, and large, and you will learn by the number. If somebody's 6 foot tall, that they need the large, and someone under, 6 feet to 5 feet needs medium, and but they're all kind of different. So you will learn that, but make sure you understand the tips for measuring crutches, because it is really important. We don't want to create more serious injuries. So again, musculoskeletal, the biggest thing about it is learning your 5 Ps, knowing that they can turn into serious injuries if they're not controlled. And, you know, big emergencies are fat embolism, of course, compartment syndrome. So if somebody ever comes in with a cast on or splint, and they say, I suddenly can't feel my fingers, or my hands really cold, the splint or cast need to come off right away, and immediately the 5 Ps need to be done. So 5 Ps need to be done regularly before the patient leaves the ER, and then in the event that they were to come back to the ER for any kind of follow-up complaint. And it doesn't happen often, but sometimes it will. And you got to look at that extremity and really look at it. Is there discoloration? Can they really feel your finger touching the bottom of their foot? Do they know that you're touching it? What are the pulses like? And what are they complaining of? Is it the foot's cold? Is it there, it's numb? Is it tingling? Is it burning? All those things are key to figuring out exactly what's going on. So big thing is actually learning the proper splinting technique, learning how to put the web roll on properly, and practicing, which we'll be doing in class this week.